Good morning. Welcome back here on Weather Command. We're tracking several major stories across the country today, including growing air quality concerns for millions across the Great Lakes all the way through the East Coast. Now, if you look out your window and the sky looks a little hazy, a little milky, there's reason for it. We've got wildfire smoke from Ontario that's spreading south and east. And as you can see, satellites already tracking a thick plume, in fact, that's going to be moving through the regions.
Well, that smoke can produce vibrant sunrises and sunsets. It also poses a health risk, especially for people with asthma and other respiratory conditions. Dr. Joseph Khabbaza, a pulmonologist and critical care specialist with the Cleveland Clinic, joins us. Good morning, Dr. Khabbaza. Let's start with the basics. What are the first signs that wildfire smoke could be affecting someone's respiratory health?
Good morning, and thanks for having me. When we talk about wildfire smoke, we're really talking about tiny particles in the air that we can't always see. These particles can get really deep into the airways and in the lungs, and that's when they can cause the biggest damage. I think for most of us, particles are just going to irritate the surfaces that are exposed to air the most. Our eyes, our mouth, our nose. We might get, itchy eyes or scratchy throat, perhaps a little bit of cough. But when those tiny particles that we can't see, these are particles that are smaller than a grain of dust, get deep into the tiny air sacs in the lungs, that's when they can cause quite a bit of inflammation that will cause some of the scarier symptoms, such as wheezing and difficulty to catching breath. And more severely, these particles can get into the bloodstream and cause inflammation throughout the whole body. So not just those with lung disease are at higher risk, but especially those with cardiac conditions, or those would have just general high inflammation in their body for various other medical conditions. They're going to be at highest risk for some of these concerning numbers you've seen. I know you posted earlier with air quality index levels greater than 500. I mean, that's really staggering.
I was just going to ask you, when everyone looks at the AQI, the air quality index, what should be the number that alerts them to, okay, this is going to impact a lot of us? And is there a general rule of thumb, if you don't have the AQI readily available, is there a rule of thumb where if I smell it, I should be protecting myself?
Yeah, so a lot of us don't have access to AQI. We might get, report from the local news that air quality is poor today. So I don't focus too much on numbers, but important to know if you're being told by your local weather correspondents that air quality is poor, that should be enough of an alert to say, all right, I need to be a little bit careful. So it's important to know, what are your personal risk factors? So do you have asthma, COPD, heart disease? So if the AQI is really above 150, we think anyone who's got any of those at-risk conditions can be more susceptible to dealing with issues related to the air quality. But like you said, if you can smell it or see it, odds are you should probably make some adjustments to your plans, like we kind of do in severe weather. If it's going to be a big thunderstorm or snowstorm, we're going to adjust our plans for the day. And I would treat poor air quality indice alerts and warnings very similarly, where you might want to change your outdoor plans that day, especially if you can smell it or see it.
And Dr. Khabbaza, I worked in California in some of the worst wildfire seasons on record. I remember one year going to find an air purifier, and they were sold out, and people were hard to find N95 masks. Now, here in New York City, there are places where you can go, specifically public libraries, and you can get N95 masks at least this week. How much do those help, especially if you need to work outside or you have to commute outside?
Yeah, so those conditions of very poor air quality, N95 are going to be the best kinds of masks to limit your exposure to these tiny particles. They are very effective at doing that. So if the air quality is very poor, especially if you've got risk factors and you can get access to an N95 and you have to be outdoors for much of the day, an N95 would be recommended. But thankfully for most of us, we're not going to have major issues, but important to be aware and look for the signs of airway inflammation, or what we call bronchospasm, when our airways might get very irritated from things that we are exposed to.
And I want to ask you too, Dr. Khabbaza, even this day and age, people get weird wearing masks. I remember when in Manhattan in 2023, we had those orange hazy skies and people were wearing masks. And some people thought, well, really, do I really need it? I'll be fine. It'll be fine. But it isn't always fine. And there is this health risk that you've talked about. If we are out there and we're not protecting ourselves, what are some of the first signs that we are in fact experiencing those symptoms of the wildfire smoke?
Yeah, I mean, I think feeling short of breath, out of proportion, doing a usual activity would be a very concerning sign to me. So if you've got a set walk to work each day, for example, you start noticing that halfway through that you are a little more winded, or generally you're not winded during those walks, that would be a very concerning sign that the airways are starting to get irritated. Now, I think most short walks or short periods of time outside of the house aren't going to affect most people, but if you're in any of those higher risk categories, that's when you may want to think about the risks and benefits of wearing a mask, kind of taking that extra precaution during those exposures. And right now, 3 years ago, I was, as a doctor in Cleveland, Ohio, I did not have much exposure to wildfire medicine, but this is now becoming an annual thing. And we do know that, this might start becoming just a chronic exposure for people in the Northeast, which may subject themselves over many years to similar kinds of lung disease from people who have other, chronic exposures, whether it's smoke or other air pollutants. So anything that could minimize short-term exposures for something that we may expect to see for years on end may help prevent, issues down the road also.
This has been a great conversation. We are both mothers of young kids, so I know I could probably speak for you too when you're trying to get outside, but then you also have to balance the risk factor potentially of smoke. So all good tips and all good things to look out for. Dr. Joseph Khabbaza, pulmonologist and critical care specialist. Thank you so much for joining us.
Thanks for having me.